that would then be pulled into a public system. So our wait lines would grow longer, and those of us that don't have the option to purchase that insurance would then be left with this system that, is again piecemeal, and it's only going to serve, us at so much more of a slower rate and a much more reduced capacity.
This year, if you don't know, marks the 25th anniversary of the Canada Health Act, which, as we have said many times today, is the foundation of our universal public health care system. The CHA was passed unanimously by Parliament, which was a remarkable collaborative effort with the NDP's Bill Blakey working closely with the Trudeau Liberal government and Health Minister Monique Begin to ensure that quality care would be available to everyone, irrespective of their financial status. Now, 25 years later, the CHA is under attack, and the Conservative government, as well as the Liberal government, is just standing by and doing nothing. Just one example of this occurred just last week when Canadians were outraged to learn that private clinics in Toronto and Vancouver were providing a queue jumping service to the rich for the H1N1 vaccine. This access by wealth is just one more example of creeping privatization and a government that refuses to stop it. New Democrats, clearly both federally and provincially, along with the Canadian Health Coalition and concerned citizens everywhere, will continue to fight against two-tier healthcare and the erosion of the Canada Health Act, as we have for 25 years. No one can demonstrate that for-profit will result in better healthcare. Today, we not only recognize the importance of the Act, but Canada's fierce commitment to Tommy Douglas's dream for Medicare.
The lawsuit was filed about a year ago. And is only now coming to the point where the courts are being able to determine how we will proceed. It should also be noted that Dr. Brian Day filed this lawsuit directly after the Medical Services Commission, which is the arm of our provincial government overseeing our provincial healthcare legislation, attempted to conduct an audit of his clinics. They had received numerous complaints from patients who had been double billed or charged twice, and other potential unlawful billing practices taking place at his clinics. They submitted complaints to the Medical Services Commission, which then triggered an audit of his clinics. They went to audit his clinics, and he wouldn't allow them inside. And very soon after, launched a lawsuit against the provincial government, claiming that the healthcare legislation under which he's practicing, he believes is unconstitutional, and so should have the right to charge as he sees fit.
The provincial government appears to be running down the system in order to make the argument that it's better off to be privatized. We've seen that in many circumstances where the province has not put in the investment into maintaining the facility or assets. So it's one of the examples and one of the reasons why they advocate for the privatization of Oak Bay Lodge. They say, well, the facility needs to be updated. Well, they're responsible for updating the capital costs of the facility because they haven't put the money in to maintain the facility. It doesn't mean that we should lose an important public asset.
Healthcare, I think, and I'm proud to say it, is one of the identifying factors of Canadians. And what does it really mean? Well, it means we care about other people, not just ourselves. And it just flies in the face of this personhood concept that comes out of the States and a lot of Western nations. This idea that it's all about the individual. When really, look what we can achieve with Medicare.
I mean, it's a U.S. way of creating problems. And we more and more are underneath the umbrella of the United States, which is very sad. I mean, I moved here from the United States in 1970 for very good reasons. And Canada presented some very fine solutions to how to help people live productive and good lives.
We have a system in Canada that is world-renowned, providing healthcare in a completely affordable fashion to all of our citizens, regardless of their ability to pay, protected by a Canadian Health Act, which allows you to travel through the country and still be provided with the same level of care. It's something that we're consistently proud of as Canadians and that we need to fight to protect and expand.
Welcome to British Columbia. This is the best place to be, but only if you're Gordon Campbell or one of his rich coterie. Mother Nature has blessed us with glory, but there are other sides to our story, 'cause Scenery isn't the best thing to eat when you're having trouble to make both ends meet. Welcome to British Columbia. This is the best place to be, but only if you're Gordon Campbell or one of his rich coterie. What we've got to sell, no one's buying, and even the salmon are dying. We sold off our railroads, the forestry's gone. We could sell you a river, but they won't last long. Welcome to British Columbia. This is the best place to be, but only if you're Gordon Campbell or one of his rich coterie.
Thank you, thank you, thank you. And let's all work.